Well, coming up, how technology is shaping our future with filmmaker Tiffany Shlain. But first, we're now in the middle of open enrollment for the second year of the Federal Affordable Care Act. The state's health insurance marketplace, Covered California, aims to enroll 1.7 million more people by the end of February. That would be 500,000 more than the number enrolled last year. Scott Shafer sat down with KQED State of Health blog editor Lisa Aliferis to talk about how it's going and what lies ahead.
Lisa Aliferis, welcome.
Good to be here, Scott.
So we are about a month into this open enrollment period. How's it going?
The first month ended Monday. Covered California released their numbers midweek. 144,000 new people have signed up. Covered California is driving to enroll 500,000 people by the end of open enrollment, February 15th.
So that includes the people who are going to re-up plus new ones?
They want the 1.2 million who are currently in to also renew. Those people, many of them presumably are already renewed. They have until Sunday at midnight to do so.
Yeah, and what happens if they miss that deadline?
If they miss that, Covered California says if they let their coverage lapse, they will be welcomed back with open arms, but they'd have to reapply, so it's a little bit easier to just renew.
Yeah, got it. So it seems like just last month that we were reporting on the disaster that was the rollout of Obamacare and the federal website especially. Take us back over the past year. What happened and where did it leave us?
So the rollout of healthcare.gov did dominate headlines, and the rollout here in California was much smoother. Covered California had an initial conservative goal of enrolling 560,000 people. They more than doubled that by the end of open enrollment. There were missteps along the way. Certainly there were glitches on the website. There were long waits on the call center, and the outreach to Latinos was flawed, and Covered California changed course in January after it was really criticized and ended up with pretty strong enrollment from Latinos as well.
And Latinos are a big portion of the uninsured in California.
They were 60% of the uninsured, so there's great desire to reach them.
Yeah, very good. And so that's great, but all is not well on the horizon. There's a big storm cloud in Washington. The U.S. Supreme Court has agreed to take up another challenge to the Affordable Care Act. What exactly is the legal basis of this case and what's at stake?
So this case is about subsidies, one of the linchpins of accessing health insurance. So the Affordable Care Act has a line that says that subsidies are only available to people in state-run exchanges. So the challenge is that those people in the 36 states that are under healthcare.gov, which is federally run, should not be receiving subsidies. Now, if the Supreme Court rules in favor of this challenge, that would really destabilize the entire act.
So it would knock out all those subsidies and destabilize the entire insurance market, basically?
That's the presumption. So California, in theory, could still stand, but if you have people in 36 states without access to health, without access to these subsidies.
Yeah, of course, Congress could fix it if they wanted to.
Experts tell me Congress, would step in and solve.
All will be well. It'll rain beer and everyone will be singing Kumbaya. Last time, of course, Chief Justice John Roberts upheld the Affordable Care Act by a 5-4 vote, so there's a lot at stake, perhaps, on him upholding this part of it as well.
There's a lot at stake.
Yeah. So one thing that was in the original law that was quite deliberate was banning undocumented immigrants from accessing any of the exchanges. But there's a move afoot in California to change that. What's the status of that?
So that bill, Health for All, was introduced last year as well. It did not get very far. It did not indicate any source of funding to improve access to the undocumented immigrants. It's been reintroduced in December by a Southern California Senator, Ricardo Lara, and there's strong legislative support. It would expand Medi-Cal to undocumented immigrants, and it would create a mirror exchange so that undocumented immigrants could access subsidies, but this would all be state financed, and we're waiting to see what the proposal is on how to fund that.
And of course, no word yet on what Governor Brown thinks about that. If it gets to his desk, he's been silent.
Governor Brown, and he also, as we know, doesn't like to approve new spending without a clear funding source.
He's clearly very frugal, indeed. And so, Lisa, when all is said and done, I realize we're still in the middle of the game a little bit, but what impact has the Affordable Care Act had, would you say, on health care, on the health system here in California?
So between the Medi-Cal expansion and Covered California, more than 3 million people signed up for insurance. Not all of those people would have been previously uninsured, but the majority, in all likelihood, have gained insurance. National survey shows that 60% of people who have access to health insurance now have used that insurance, And of those, 60% say they would not have been able to access that health care, see a doctor, fill a prescription, go to the hospital. They would not have been able to afford it without the insurance. So it's making a difference.
And none of the big critics' fears have come true. Is that fair to say, in terms of rising costs or that sort of thing?
The increase in premiums this year in California was the average was about 4%. So for the moment, we're in this period where it's still early days.
All right. Lisa Aliferis, editor of KQED's State of Health blog. Thanks for coming in, and good health to you in 2015.
And to you, Scott.
Thanks.